Thank you, Connie. That was amazing. Before I forget, in case no one else says it, the Medicare for All resolutions, like Representative Jayapal spoke about, have been passed in Colorado thanks to the efforts of Rich Shannon, raise your hand, Rich. Yeah. Thank you. It's awesome that I'm probably going to miss one, but the city and county of Denver, Larimer County, I think the city of Fort Collins, Boulder County, the town of Jamestown have passed these. So yes, we can do this. And Longmont, thank you. And so y'all in other areas, consider that, and Rich will help talk you through it. Our next speaker is near and dear to my heart, both because he's a master communicator and also because Wendell Potter left a 6-figure job in corporate communications for Cigna to stand up to corporate control over the lives and often deaths of Americans. As he describes in his book, Deadly Spin, and Bryce, you're about to find out, and in the documentary Healing Us, Potter found that working for a company that denied life-saving healthcare was morally untenable. I don't know about you, but I think about bravery a lot these days. And I hope when faced with a choice between what's safe and what's right, I will choose what's right. In 2009, he made headlines with scorching testimony before a Senate panel on health reform. While President Obama tried to win real reform in healthcare, in the end, the corporate powers that be ensured that Americans were required to buy health insurance rather than getting to receive their needed health care through a single public or highly regulated universal health care system like those enjoyed by those in all other industrial democracies. Wendell became an advocate for improved Medicare for all, and now, with his book Nation on the Take, he's focused on ending the obscene influence corporations wield in our harmed democracy. His more than 16,000 Substack subscribers to his Healthcare Uncovered QR code on the back of your program enjoy his in-depth, thoughtful analysis. I know I do. Let's give a Colorado welcome to Wendell Potter.
Sara, thank you so much. That was so generous of you, that introduction. Thank you all for all you do. Thanks for inviting me to come back to Colorado. I've been here a number of times. It's good to see old friends. You are, well, I'm an old person, so I'm a man of a certain age, like Rose, benefit from Medicare these days. Thank you all very much. I had a speech prepared, but I'm going to just talk. Several years ago, after I became a whistleblower and was on Capitol Hill quite a bit, I was invited to give a talk with Congresswoman Louise Slaughter from New York, who was chairing the Rules Committee. And I was terrified. I was kind of new to this at that point. And I had some remarks prepared. And just before we were going out to meet a bunch of reporters, she said, let's just talk. And so that's kind of what I want to do. And maybe reflect some on what I've heard this morning and this afternoon. The presentations have been remarkable. I've learned so much and have renewed vigor for continuing the work that I do as well too. And to see you all so dedicated to what you're doing. Some of what I'm going to be saying, though, I'm going to ask you to do even more, to be honest with you, because I think there are some things that we need to do. And it touches on the subject matter of my second book, Nation on the Take, How Big Money Corrupts Our Democracy and What We Can Do About It. But I want to step back and, for those of you who don't know who I am, maybe give a little bit of a self-introduction beyond what Sara told you. I'm from Tennessee. I grew up in a small rural town in southern Appalachia. First person in my family to go to college. I wanted to be a journalist, and I was a journalist in my first career. I was lucky enough to be the editor of my student newspaper at the University of Tennessee and just fell in love with journalism and the idea of being a journalist. Became a reporter in Memphis and then Nashville, and Washington. I covered Congress and the White House and the Supreme Court for Scripps Howard newspapers, which and some of my stories actually showed up in the Rocky Mountain News back in the day. So that was a long time ago, as you all know. But I was kind of lured into PR work because, as Tom and others know, it pays more than journalism does, unfortunately. And I wound up working for two big health insurance companies. Not initially in healthcare. I worked for a medium-sized hospital system based in Knoxville, Tennessee, initially. And from there was recruited to Humana. It was in the early days of managed care, and I was very naive. I thought, well, this sounds pretty cool. It sounds like a very reasonable approach to healthcare. So I was quite willing to take that job. And at that point, Humana was largely known as a hospital company. I had just worked for a big hospital system. While I was there, the company decided to spin off those hospitals so it could focus exclusively on managed care. It realized, and most importantly, the shareholders realized, that the company could make more money selling health insurance and managing care, and as Rose said this morning, really managing costs, not really managing care, except managing for you not to get the care that you need more often than not. But I managed the communications around the sale of many, many hospitals while I was at Humana. Soon after that, I was recruited to Cigna, where I stayed for 15 years, and I rose up through the ranks. Was vice president of corporate communications when I decided to walk away from that career. Among the things that I did, my name was on all of Cigna's earnings reports for 10 years, so I had to know how the company made money, where the money came from, what we did with it, and I got a good education about what really motivates and controls the decisions that are made in the C-suite of these big companies. And I can assure you that it is what Wall Street expects of these companies. Wall Street has been mentioned a few times today, and I will tell you that it is what we are witnessing now is what happens when a healthcare system comes under the control of Wall Street. And we're seeing the consequences of that. We have, at one time, the most expensive healthcare system on the planet. This year we'll spend over $5 trillion on healthcare. We'll spend twice as much per capita in this country on healthcare as the average of other industrialized countries. We spend almost 20% of GDP now on healthcare. But it's also one of the most dysfunctional and unfair systems on the planet. So you've got all of this, and the reason for that is because of Wall Street's demands for more and more of the money that we pay in premiums to go into their pockets. I, as part of my job, had to answer questions from reporters of the Wall Street Journal and the New York Times and other media outlets, primarily from media outlets that served shareholders more often than not, from Dow Jones, from Bloomberg. Those were the reporters who called me more often than other reporters. They had more of an interest, and most of their stories were stories that investors saw. So, but occasionally I would get calls from reporters who were asking why Cigna was refusing to pay for care that somebody needed. And these things began to wear on me. And I ultimately, as you all know, I wouldn't be here if I hadn't walked away from that job. But I made a mistake of going back to visit family in Tennessee. This was in 2007, and I picked up a newspaper while I was there about something called a healthcare expedition that was being held a few miles away. I went out of curiosity, borrowed Dad's car to drive up to Wise County, Virginia. Our town was right on the Virginia state line. Wise is just a few miles on the Virginia side. A coal mining area. The newspaper article I read said that people were expected to be driving from hundreds of miles away to get care there. I'd never heard of this organization. that was sponsoring it was called Remote Area Medical. It was started in the 80s to fly U.S. doctors to really remote parts of the globe, to take doctors to provide care to people who really had almost no access to care. But increasingly, the organizers of Remote Area Medical started getting calls from people in this country asking, could you please bring an expedition to our communities because we've lost our doctor, we've lost our dentist, or we have so many people who are uninsured, who've lost not only their jobs in many cases, but as we know, when you lose your job, you often lose your health insurance. So that was the plight that was very prevalent at that time, still is, of course. So one of the communities where Remote Area Medical started serving that community was Wise County, Virginia. And word had gotten out. People were driving from as far away as Ohio and South Carolina to come to this little hamlet in the mountains. And I decided to check it out. At the time, I was writing a white paper for Cigna and for the industry. It was at a time when we were anticipating that if the Democrats won the next election, there would be a big push for health care reform. And yes, Barack Obama was elected. Democrats gained control of both the House and the Senate. But in anticipation of that, part of my job was to try to get people to think that the problem of the uninsured was not a big deal after all, that most people who were uninsured, and there were almost 50 million at that time, were that way by choice. And you can slice and dice data and tell stories to get people to believe almost anything, and that was what my job was to do. But when I went to that county fairground and I walked through the fairground gates, I saw people who were hundreds of people. There were hundreds of people there that day, standing in long lines that stretched out of view. It had been raining that day. A lot of these folks were soaking wet because they were not going to lose their place in line. Many of them had spent the night before in their cars and trucks, and only a few could get into the fairground gate through the fairground in a given day. And as I looked, I saw that a lot of those lines led to barns and animal stalls. This was the county fairground. And that did something to me that just shook me to my core. I realized that people that I could have grown up with, people I could have been related to, were likely in those lines, or could be. And I could have been myself had my parents not been able to save money to send me to college. And to know that other human beings were having to resort to getting care in barns just did something to me. And I also realized that what I was doing for a living as a propagandist, I've often said that my title should have been not VP of Communications, but VP of Propaganda. I was getting people to believe things that just simply wasn't true, just so that shareholders could get a little bit richer. And I assure you that's exactly what the game is all about. My major job objective for my time at Cigna was to enhance shareholder value. And me in PR, that was my top objective. That was everybody's top objective. You have to do, regardless of who you are in a company like this, you have to pull your weight. You have to do whatever you're expected to do so that ultimately the company can meet Wall Street's profit expectations. Long story short, I eventually left my job. I made a commitment that day to leave that career. I did. I took about a year before I had the courage to really speak out against my industry. I began to work with advocates after Obama was elected to see if I might be of some usefulness. They persuaded me that if I wanted to make a difference ultimately, I should go public with my story. I was terrified of doing that. I knew how the industry tried to silence its critics. One of my assignments a few months earlier, or in 2007, was to try to discredit Michael Moore and the movie Sicko. I saw some reference in one of the signs out there to Sicko. So I know how this industry operates. But I ultimately decided that I would do that. I would speak out in some way. And as it turned out, I was invited to provide testimony to the Senate Commerce Committee on June the 24th of 2009. It's been, almost 16 years now, whatever. It's been some time. The committee decided to publicize this pretty well, and I just came across actually a Wall Street Journal story about my testimony for the first time. Today's the first day I've even seen this, but from 2009, the headline was "Former Exec Insurers Confuse Their Customers, Dump the Sick," and it reads, "A guy who spent his career working for health insurance companies went to Capitol Hill today and unloaded on his former industry. Here's how he kicked off his testimony to the Senate Committee on Commerce, Science and Transportation. My name is Wendell Potter, and for 20 years I worked as a senior executive at health insurance companies, and I saw how they confuse their customers and dump the sick, all so they can satisfy their Wall Street investors." Potter, who worked for many years as a spokesman for Cigna and before that was at Humana, described the pressure within companies to meet targets for earnings and the medical loss ratio. And I was one of the first people to talk to Congress about something called the medical loss ratio. Insurance companies consider it a loss every time they pay a claim, hence that term, medical loss ratio. The Affordable Care Act, when it was ultimately passed, did contain a provision that addressed the medical loss ratio, but unfortunately, I think what we have seen is that the industry has figured out how to game that big time. And sadly, I would say the Affordable Care Act has done some good. It did bring a lot of people into coverage, but as Rose said this morning, we've got, I think, 85 million Americans who are either uninsured or underinsured. Those numbers are going to go up if the big, beautiful bill is passed. There's no doubt about that. We probably will once again get close to 50 million Americans being uninsured. But a big part of what I write about today and talk about today is the number of underinsured people that we have in this country. People are paying good money, and our employers are subsidizing our premiums. But increasingly, we can't use our coverage because our deductibles are so damn high. The Affordable Care Act set a limit on how much we have to pay out of our own pockets before our coverage kicks in, but it's extraordinarily high, ridiculously high. And it goes up every year because the insurance industry insisted on having that mechanism of making those go up every year. For a family these days, this year, I think it's $18,400, something like that. And that's ludicrously high. Most families don't have that kind of money in the bank if someone in the family gets seriously ill or injured. That's why so many people don't get the care that they need, don't pick up their medications that they need. And if they do, they often wind up in bankruptcy. 100 million Americans now have medical debt. And the vast majority of those people have health insurance. And all of this, folks, once again, is because we need in this country to satisfy the needs of Wall Street's investors. Now, why are we in this situation? It's because of money in politics. There's a lot I wanted to say, and I want us to have a conversation here. But the reason I wrote Money on the Take is because part of my job at Cigna was to dole out campaign contributions. I saw how that part of this whole thing works as well, too. I wrote a piece for Healthcare Uncovered, that newsletter that Sara mentioned, and I hope you will subscribe. It is free. You can pay for it if you want to, but it is free. We want everyone to have access to the content. But I looked at this website called Open Secrets, which tallies campaign contributions from donors. Because I was curious to see, well, who were they betting on during this last election? And I had my assumptions, because I know these guys. And I know that over the years, they have donated as much to Democrats as they have to Republicans. They have plenty of Democrats in the back pocket. If they didn't, you would have single-payer health care here in Colorado. California would have it. California's had a super majority of Democrats for a long time. There have been many single-payer bills that have passed but have never been enacted. And money in politics is the reason why. What I did after doing my math, I realized that of the $3 million that health insurance company executives and employees donated in this last election cycle, 2.5 million of that went to Kamala Harris. 85% went to Kamala Harris. So I then looked, well, okay, where did they? Which congressional candidates did they bet on? The majority, and these I'm talking about seven largest for-profit companies. And they're all New York Stock Exchange companies. the majority of those donations went to Democrats. That's why the Affordable Care Act didn't go any farther than it did. When Obama was elected in 2008, his term started in 2009. Congress, there was a big majority of Democrats in both the House and the Senate. We even had 60 votes in the Senate. And we still couldn't get anything better than the Affordable Care Act. And it is because of money in politics. So the thing that I want you all to do, I know it's hard, and people are just so passionate about Medicare for all. I am. But I think we need to try to figure out if we've got some capacity to also be passionate about changing our political system and how it is controlled. We really need to do that. And I encourage you to read Nation on the Take. It is, and it shows industry by industry how big corporations and their trade associations are able to call the shots in Washington and Denver, all over the country. Uday Reinhardt has been mentioned, I think, earlier, and Tom and I were talking about him. He has been an advocate of the single-payer healthcare systems around the world. He once famously said that as much as he would like to think that the U.S. could have one, he didn't think that it would work here because of our corrupt political system. And he's got a damn good point. So job one, in my view, maybe it's job two, but keep your passion, your advocacy going for single-payer healthcare, for doing it at the federal and the state level. And Pramila Jayapal is right. We need both. Try to find some time to focus on how we can reduce the power and impact of money in politics, because it's always going to be difficult for us to move forward to get the kind of healthcare system we really need. A little bit more about what I'm doing now, then we'll stop, and if this time have a few questions in the discussion. But in addition to Healthcare Uncovered, which I started because the major media period is just not doing a good enough job of covering healthcare and holding these big companies accountable. So that's why I started that, and that's what we endeavor to do, is to be a watchdog and to call these companies out for the way that they have corrupted our healthcare system and are rewarding their shareholders as they do it. I also lead the Center for Health and Democracy. The word democracy is in there for exactly what I was just talking about. We need to restore our democracy. We need to change how we who we allow to be really running the show. We need to take the power away from big corporations. Citizens United was one of the worst decisions I think the Supreme Court has ever rendered, and has created such a big mess. And so we've got to address that. I also lead an organization, too many hats, and this is one I don't give as much time and attention to, but I should. Business Leaders for Healthcare Transformation, because we're trying to get business leaders more engaged, more aware, and more supportive of what we're all in this room trying to do. There were a couple of questions earlier about why don't we see more businesses engaged in this, and I think primarily is they're afraid to step up and take a position on healthcare reform for fear that they might alienate some customers. It has been more of a challenge to get that nonprofit up and running than it has the Center for Health and Democracy. I spent a lot of time in Washington wearing those hats. I have lately been meeting, believe it or not, with more Republican offices than I have with Democrats, because Republicans are running the show in Washington these days. We all know that. But I'm finding common ground. Rose and others have talked a lot about today Medicare Advantage. It's something that my team and I are very much involved in. Our director of policy and advocacy for the Center for Health and Democracy worked for Pramila Jayapal until she joined my team. She is fantastic. We spend a lot of time in Washington meeting with anybody who will meet with us, trying to help Republicans understand how this program that they started back in 2003 with the Medicare Modernization Act and named it Medicare Advantage how it's been overtaken by these big corporations and how it has moved so far away from what they intended. So we're making some traction. It's conceivable, maybe not likely, that even in this big, beautiful bill, there could be some constraints on Medicare Advantage plans. We'll see. Certainly in the area of upcoding. I also spent a lot of time on prior authorization. We all know, we've heard earlier about the burden and the reasons for moral injury among healthcare providers of all kinds, nurses as well as doctors, because of the demands of insurance companies. Cigna has about 4,000 services, procedures, and medications they require prior authorization for. The traditional Medicare program has about 50. And those are only in the areas where it could conceivably be cosmetic, in addition to medically necessary. You don't need that apparatus, but it adds so much administrative waste, cost, and burnout among doctors. We focus on out-of-pocket costs. I lead a coalition of organizations, more than 100 now, that's focused on lowering the out-of-pocket costs for Americans, and I'm working at, stay tuned, because I think we'll have a Democrat and a Republican sponsoring a bill in the House at least this year to lower out-of-pockets for all Americans, regardless of the kind of health care you have, to at least $5,000 and not that $18,000 a year. And adequate networks. We all know that these proprietary networks that insurance companies have are often inadequate. 2 weeks ago, I was in Los Angeles on a panel about ghost networks. A lot of these networks are not real. The doctors who are supposedly in network often are not. Some never have been. Some have died. Some are not taking new patients. And as a consequence, it is extremely difficult for people often to get the care that they need anywhere close to where they live. And this is especially true in mental and behavioral health and addiction care. So I want to shut up because I've covered a lot of ground, but I again, just to kind of wrap up, I hope you will subscribe to the newsletter. Let me know what you think of it. If you have story ideas, let us know. But also get involved in efforts to try to reduce the power and influence of the companies that I used to work for. Thank you very much.